Okay. So this is your letter number one. Dr. Robert Edwards, neurologist. This is fine. It's just one thing that I would like to mention over here. After little town over here, spare one line. I mean, you could have mentioned state over here. Okay, that's
Okay.
okay. Okay, here Dr. Edwards, this is also fine. And then you can spare one more line here, and then you can write RE Miss day, date of birth, and then you can, I mean, this and this line can be together, but others, there should be a spare line. Okay, that would look more better. Okay, I'm writing to refer Miss Sarah Day. I would prefer Miss Day for further evaluation and management of her persistence in electoral head. It's fine, no problem. You're writing a simple referral letter, you can simply write this way, no problem with it. Uh, but here in the most recent visit, it was not only about headache, he was also experiencing a few of the symptoms regarding paresthesia in her fourth and fifth finger. It could be suggestive of some neurological involvement as well. So you can mention those things as well. Okay, that would enhance your purpose. This purpose is also fine. Okay, but if you add those two like half a line or 2.5 words, then it will be more better. Okay, now let's move forward. Okay, Miss Day. Okay, so whenever you're going to write the paragraphs after your visit, sorry, after your purpose and everything, you have to just go with the second name when the age is less than, sorry, when the age is more than 16, go with the second name with the Miss, Mr., Doctor, whatever the title they prefer. And whenever the age is less than 17 or 16, then go with only the first name. Okay.
Yeah.
Miss Day initially presented on this date with unilateral headache, which was steady, non-throbbing, extending from temporal region to vertex, dizziness, nausea, and anxiety. Okay. Along with, okay, now see, when you're writing along with, so there should not be a full stop. Okay. But if you're adding a full stop, then do not start with the along with. Along with is a linking word, or you're linking a sentence to the other portion. So anxiety, okay, that's it. She also complained regarding visual disturbances. Okay, that could be more better. Okay, or you can simply merge this with the word along with visual disturbances and add a full stop over it. Am I audible to you?
Yeah, yeah. I can hear you.
Okay. Her symptoms were not associated with menstrual cycle or stress and not aggravated by alcohol, chocolate, cheese, or sunlight. See, if something is not aggravated, it's not related, you might be trying to tell the reader that it was not migraine, okay, which is fine, but do not write 3 lines about it. She also reported workload, stress, pressure of assignments, and this is wrong. Always write the full word A and D. And okay, and exams. She complained of 2 episodes in the past 2 weeks. Pain initiated with rapid when her neurological examination. While her neurological examination was unremarkable, she was advised, not advised, on sleep hygiene measures, regular diet. Okay. Okay. Now, a few of the things that I would like to mention over here. So you have written a lot of information. one of the
Yeah.
criteria from the official OET is to concise. Conciseness has its own scores. Okay. So when they say that you have to concise the lecture, it means you're you should write less words. Okay.
Yeah, yeah, I got it.
Yeah, sorry for that. Okay. So you have mentioned a lot of information. So how you can concise this? So you just have to write Miss Day initially presented on this date with unilateral headache, which was not throbbing or extending, or you can just write unilateral headache along with dizziness, nausea, and anxiety. She also reported visual disturbances. Okay. Now, then she also reported workload stress. Okay. Or she also mentioned workload stress, pressure of assignment and exams. Okay. She had she had two similar episodes in past 2 weeks. Okay. And pain was initiated with rapid onset and aura. So I'm trying to say whatever you want, the way you want to write, that is your personal choice. But I'm saying that there's no need to explain a lot of about throbbing this and that and this and that. Okay. And do not mention these 2.5 lines, whether it was associated with menstrual cycle or alcohol or chocolate and this and that. Okay, so you can eventually decrease your word count. Are you following me
Yeah.
so far?
Yeah,
Okay,
yeah.
and that is important. Okay, just give me a minute, okay? Okay, where's this? Where's this? This was it first. This should be second.
We can have a class tomorrow if you don't feel good, doctor. No
Oh,
problem.
no, no, it's okay. It's okay. It's just why it's not loading up. I don't know. This picture is not loading. Okay, now it's fine. Okay. And medication. Okay. During attack, she was advised, again, it should be S, okay, to sleep in dark
Yeah.
room and was commenced on methoclopramide 10 mg orally 20 minutes later. Paracetamol. See, again, the problem with your letters are, sorry, or is that you are overly explaining things, okay? Now, let me be very clear about it. It is not a medical exam where you have to tell all the history of the patient to the reader so that they or you can make a diagnosis. Okay. It's not about that. It's only about showing your writing skills to the OET official so that you can pass your exam. Are you following me so far? So do
Yeah, yeah.
not overly explain that, okay, 10 mg orally, 20 minutes later. See, it doesn't make any sense. It doesn't give you any extra score if you'll explain this further that the patient has to take metoclopramide 10 mg, it should be taken orally 20 minutes later off or something like that. Okay. It doesn't give
Yeah.
any extra score, even if it will reduce your scores because you're overly explaining things. Okay. You just have to write that she was commenced on metoclopramide and paracetamol, nothing. there's no need to write those. Even if you write those, if you want to write it just to satisfy your own self, you can write it down, but if you can skip it, still is fine. She reported with more frequent attacks and worsening of pain, dizziness, anxiety, and vomited once. Okay, she was prescribed alithriptin 40 mg orally during attack and ibuprofen. See, now here that this is fine, but why you? Okay, so she, if I'm not wrong, yeah. So this is fine the way you have written. Okay, this much of information is okay to write. But if you write ibuprofen 400 mg, this and just I can still bear it. Okay, 40 mg of alithriptin orally. Okay, I can take it, but do not overly explain 20 minutes and this and that. Okay, even if you write prescribed alithriptin and ibuprofen, that's it. On subsequent, because you have to concise the letter. You just have 200 words, 180 to 200 words to complete your letter. But if you write two gigantic pages, okay, that will eventually increase more like your word limit. It should be about 250 words. You're already lacking behind, okay? So don't do that. On subsequent visits, she complained of drowsiness and diarrhea commenced since uh, commencement, you can write this, or since she started taking alithriptin, okay, with no improvement in her previous symptoms. Miss Day described anxiety as panic while her mother complained about her loss of interest in daily life activities. She was prescribed she was prescribed amitriptyline 25 mg, okay, not on. She was commenced on and she was prescribed amitriptyline. Okay, so with
Yeah.
commenced you will write on, with prescribed you won't mention on. Today, Miss Tay reported with numbness and tingling in her left hand's fingers and no improvement in her previous symptoms. She also reported car accident back in June 2018. Uh, sorry, 2017, had sustained whiplash injury and no treatment was taken at that time. Okay, fine, you can mention. Miss Day, Miss Day, okay, is a university student, not happy with study course, okay, doing part-time jobs and has irregular sleep hours. She's on OCP. Okay, just write COCPs since 2013. Again, over explanation. Okay, and has no family history. If there is no family history of headaches, don't mention that there is no headache and migraines in the family. Okay. In view of the above, you further assessment management. In view of the above, I would be grateful if you could further manage and assess the patient, or assess and manage the patient accordingly. Okay, in case of any queries, please do not hesitate. Do not hesitate to do what? Do not hesitate to contact me. Okay,
Yeah.
doctor. So, if you ask me about your English skills, I would say they are good. If you ask me about letters, I would say they are fine. If you ask me about you know about this particular letter, it's not fine. Okay, why? Because you just don't need to overly explain things. In your letter, if you see yourself, it's still the reader will understand the condition of the patient. Okay, but if you write every aspect of the case notes and just copy paste it over in your empty page, that doesn't make sense. Okay, so you have to understand that you have to skip few of the things. Okay, is that clear?
Yeah, yeah.
Okay, now